Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
And on this Thursday, we welcome Lee Aase in studio with us today. Very nice
to
actually see you.
Yeah,
that's a good thing. And you and I were chatting right before we were going on the air here today. Today is really a monumental day, if you will, because you were showing me pictures literally from just 1 year ago. Tomorrow, I guess it would be. Pictures of your lobby area, your building area, and it was a location very much under construction. And man, it seems like light years away in the past that suddenly we have this clinic and things are rolling right along. It's been an amazing year.
Yeah, it's really been astonishing. And so Thanksgiving is a month ago, but we've got a lot of Thanksgiving today, to just look back at the way things looked, as you said, very much under construction, and we were still a month away from opening. And to be at the point where we are now with more than 500 active members, and then the other big news that we have today is that Dr. Dave Strobel, who's the owner of the clinic, is now able to be with us full time. So he had been working, and just tell a little bit of the story when we started up, and just all the gradual way this has worked, and just kind of fallen together in a way that's frankly beyond what I could have orchestrated. So, we're seeing the hand of God in this. But we started on February 4th was the first day that we did appointments, and it was a Friday. And then the next Saturday, the day after that, we were saying, okay, what are we missing? What do we have to get? What supplies do we need that we didn't have? So the next week we did Friday and Saturday morning, and then Friday and Saturday morning again, and then it was Thursday, Friday, Saturday morning. And meanwhile, Dr. Dave has been working since 2017 with the Pipe Trades Family Health and Wellness Clinics up in the Twin Cities, which kind of inspired what we've developed with HELPcare Clinic, and gave us a little bit of the model for what we're trying to do. And we're just grateful that he's been able to gradually wean himself off of that, and as our membership has grown, he's been able to take over more days here and fewer days up there. And for the last several months, it's been just 2 days a week that he's been up in the Twin Cities. And we've had Stephanie Kimmis, who's our pediatric and family nurse practitioner, has been filling in on those other days. So we've been able to have daily appointment availability. Well, as of Tuesday was his last day with the Pipe Trades Clinic. And so as of right now, he's working Monday through Friday and Saturday mornings with the HELPcare Clinic. And so even as we're opening up in Rochester, we're going to be he's going to see his first appointments over there on January 9th. We're still having an extra day a week beyond what we have had in Austin. So we just want to reassure people that he's not going anywhere. Right. That he's, in fact, this is enabling him to really reestablish his roots here, and it's not any diminishment at all of what we're doing in Austin as we're expanding to Rochester, that he'll still have even more availability here than he's had there.
Well, and I think obviously it gives him a different focus too, because now he can be 100% focused on HELPcare Clinic, Austin, Rochester, as opposed to being at the pipe fitters and having to exclusively that's his job, except when he's here. So now his focus is all down here, and that's huge.
Yeah, so it's been great having, Stephanie, our nurse practitioner, able to fill in on Mondays and Tuesdays when he was with the Pipe Trades Clinic. And that was so we were able to meet the timely, urgent needs, because he can't be treating people with our clinic when he's at this other place, even with the phone calls. And so this just gives us a lot more flexibility. Even when he's in Rochester initially, as we're starting up, he can be doing phone appointments with people from Austin, and those can happen any place. But so it's really just a big milestone day for us today.
I really had in my head I was going to ask you this question, but I really can't now because we've kind of answered it. I was going to ask, could you ever have imagined? The grand plan was it would be this great, but in your mind where reality sits, did you really think it would take off this fast?
Well, I'm a pretty optimistic guy by nature, but yet I have been just astonished at how the pieces have come together, as I said, in a way that I really couldn't have orchestrated. We've never posted a help wanted job, position, posting. So we've never advertised for employees, and yet we have 6 wonderful part-time nurses who are full-time moms who are working with us. Stephanie, our nurse practitioner who started in May, came through a connection we had at church, and she said, my neighbor's a great nurse practitioner. And as it turns out, she is, and so that's been really neat. And then just the way the pipe trades clinic has worked with us and been really flexible and said, sure, you can, go 3 days a week and then 2 days a week, that we're able to maintain that relationship and that good relationship. So yeah, pretty outstanding.
Well, and the amazing thing is that people who were either coming in as a client, a patient that signed up, and then decided, they said, I have a skill set that can help you out. I want to be part of this team, or I know somebody who's available to be part of this team. That sort of investment, I don't think you could have ever imagined that people would just be knocking on your door saying, I want in not only to be a patient, but really to make this model work.
Well, and that's the whole thing, is it's membership. Okay. So lots of times in most industries, and particularly in healthcare, it's a transactional thing. You're sick, you go to the doctor, and with membership, it's like belonging to something that is bigger than yourself, and that's making a difference for people. And we're seeing that all the time with people who are restoring their health. They're getting on top of some things that have been nagging them for a while, and things where they just haven't had the time to be able to have an in-depth conversation with their provider, and that consistency that we're able to have. And so, it's a sense of ownership that I think our members have, that this is something, especially our founding members, because they signed up, a lot of them, when the building looked like it did a year ago, and they believed
studs.
They believed in what it could be, and and it's their talking to their family and friends about their experience that's really been, along with KUS Radio, of course, helpful in getting the word out and helping us to attract continually more members.
Well, and we should talk about that, because obviously you have room for plenty new members that if people are hearing about this, want to find out more, this would be a great time to be able to do that and get in and be part of this.
Right. There's we're at about 530 members right now, and that includes Rochester. We can handle a lot more. I mean, so with Dr. Dave being able to be here 2 more days, we've also had someone, not ready to announce it yet, I'll just tease it a little bit, but a physician assistant who has approached us and said, I'd really like to be part of this. And so probably toward the end of next month, she'll be joining with us as well. So we definitely have the capacity to be able to see more members. And it's still a great time to get involved. People who get an annual membership save 16%. So they buy 10 months, get 2 free. But for those who want to start out on a month-to-month, it's still really affordable. And for most people, it's less than the cost of their deductible. So it includes all the services that they would typically pay for with their deductible, like lab tests and some generic medications. And, of course, the office visits with no per-visit charge. But the fact that they can, kind of make one payment or monthly payments and have that be, okay, that's what my healthcare expenses are likely to be for the year, unless I need some kind of, specialty care, in which case we can get you referred for that too.
Yeah, absolutely. Like I said, it's been an absolutely amazing run. We got just a minute here. I remember coming down and taking a tour with you through the clinic, and you took me upstairs, and the area that you weren't using at all and maybe not using yet, but you turned to me and you said, well, we have plans. And as this has evolved, really it's played out in amazing ways. You're really touching lives here.
Yeah, it has been great. And yeah, we do have the second level, which, with no elevator, we can't see patients there, but we may be able to at some point maybe move some of the administrative offices up there if we need more space to see patients. But we're just really gratified at the support that we've had in the community and thankful for that.
It's been a great 2022. We appreciate you being part of our show here, and we look forward to our continued relationship in 2023.
That sounds great.